everyone. I'm Ashley. I am a doctor of physical therapy specializing in pelvic health and the creator of Your Strength Within. Your Strength Within was started by me to just provide a space of education and support for women as they go through some of these pelvic floor dysfunctions, and just to let everybody know that they aren't alone through their journey. And even though some of these things are super common, they're not normal, and you don't have to deal with them alone. And there are things that you can do to improve. So we're going to talk briefly about what the pelvic floor is. Know that this isn't an exhaustive list of what the pelvic floor does or everything about the pelvic floor. Just want you to have kind of a general understanding of where it's at and kind of what it does. And then we're going to talk about some of the dysfunction that can happen because of something with the pelvic floor. Okay, so here's your hips, right? And you can see kind of the bottom and then the opening from the top. The pelvic floor sits right inside of that opening. So it's this bowl-shaped group of muscles that sits inside of there. There's a right and a left side, and although the right and left side work independently, they also have to be able to work together, just based off of where the pelvic floor is located. So it's inside of your hip bones, right? So if you think about where your hips are on your body and what happens when you walk, move, sit, stand, everything, right? Our hips are kind of the center of the skeletal system. So, and they provide the biggest base of support. So the pelvic floor, if there's some kind of dysfunction in the pelvic floor, that's gonna not only cause some other dysfunctions that we'll talk about in a minute, but one of the main things that people don't often think about is it causes dysfunction with just everyday life activity. Dysfunction of the pelvic floor can look like pain anywhere in the pelvic region. So internal pain, abdominal pain, hip pain, butt pain, back pain can all be stemming from something going on with the pelvic floor. Incontinence is also another dysfunction of the pelvic floor, which means an involuntary loss of urine, or you can have bowel incontinence as well. And incontinence can be anything from just a couple dribbles to a more significant loss. All of that is considered incontinence. There are different kinds of incontinence that you can work with your provider to figure out what type you have, which helps guide us in what type of treatment is going to be best for you. Dysfunction can also look like some breath work. So when we breathe, right, so the diaphragm sits here, it's kind of shaped like a dome and it sits inside of your rib cage. When we breathe, it kind of does this, it moves up and down like that. A pelvic floor that's functioning correctly, and if you have the connection and the efficiency coming from diaphragm and pelvic floor working together, your breath pattern is much improved. So if we don't have this internal system working together, we're going to have decreased oxygen going throughout our body, and we have a decreased deep support system. Think of kind of that diaphragm to pelvic floor as like your base for your outer system, meaning like arms and legs, to move upon. And if there's ever a disconnect or something causing a decrease in messages being sent to the diaphragm or pelvic floor and they can't work together, then something else is going to suffer down the road, right? So when we're going to talk about incontinence a little bit more because it's one of the most common ones, so much so that it's considered normal. I think it's about 1 in 4. The statistics vary depending on what you look at, but most of them will say 1 in 4, or 1 in 5 women suffer from incontinence. And the National Society for Incontinence tells us that women usually wait 6.5 years from the time that they start experiencing incontinence to when they go finally seek help. And that's pretty alarming, and just doesn't need to be the case. We see lots of Depends ads on TV. We see all of these messages that tell us that because we've had babies, because we're getting older, that we are going to have incontinence, and it's something that we have to deal with. And there are pads that you can buy to help, and that's just what it is, right? So The pelvic floor is just like any other muscle. It's a little bit interesting because of the placement and how we kind of evaluate and really determine what's going on with the pelvic floor. But if you have an injury to your bicep, it's pretty common knowledge that you can do some rehab, physical therapy, or otherwise to get stronger through your bicep, to heal whatever injury is there. And it's not really second guessed. It's kind of, okay, I have this injury, I'm going to go do something about it, and that's that. The pelvic floor really should be treated no differently, and we do ourselves a disservice. We do other women a disservice to not talk about it, right? And it's just something that we don't talk about. It's not something that often comes up at the dinner table, right? But my goal would be, or my encouragement for you guys would be, to just have a conversation with one of the women in your life, and it doesn't have to be somebody that's older than you. Unfortunately, the numbers are changing as far as how young women are experiencing incontinence. I believe that it's always been an issue in young women. However, it's not a study that's typically done in research. And now we're finally getting some of those numbers that show that incontinence is happening at a younger and younger age, or we're more aware of it happening at a younger and younger age. So if you think about, like, if you have a daughter or a niece or a cousin or somebody who is younger than you and they're experiencing incontinence, the last thing you want them to do is think that they're alone going through it, right? So have a conversation with somebody about these symptoms and just ask them, how do you feel? Have you ever experienced this? One of the things that young girls do, they'll use toilet paper, they'll use menstrual pads to kind of help decrease some of that, which is just, it's just really sad, because there are things that we can do. Pelvic floor physical therapy looks like rehabbing the pelvic floor. Sometimes the pelvic floor has a bunch of restrictions in it, and strengthening the pelvic floor isn't actually indicated right away. Sometimes we do need to strengthen the pelvic floor, and that's where we start. Kegels are something that's thrown out there by everyone that we should just do, and I read an article recently that said 100 Kegels a day is the magic number to have a really awesome pelvic floor, and that's that. As a practitioner who works with the pelvic floor, it's really one of the most dangerous things that we can say to women. And the reason is, if your pelvic floor is not in the position and shouldn't be strengthened at that time, doing a bunch of Kegels can be detrimental to your recovery. Kegels can really make the problem worse, and they're often not done correctly. So really the only way to know if we're doing a Kegel correctly is to have somebody evaluate us and teach us how to do it. So if you've been told to do a Kegel, don't worry. But I would strongly encourage you, if you're having any of these symptoms, to seek out some help, to find somebody that you trust, and to have that practitioner evaluate you. Your typical gynecology appointment, they make sure medically wise that everything is going well, but they don't do a muscular evaluation of the pelvic floor. That doesn't mean that they're supposed to, right? But there are people who can give you that evaluation if you're experiencing incontinence, pelvic pain, pain with intercourse, constipation, abdominal pain, hip pain, back pain, anything like that. There are physical therapists out there who will do the evaluation for you, give you a better understanding of how things are working, how you can better improve the quality of the pelvic floor contraction and relaxation, which is something that we're not going to get into really here, but that your pelvic health PT will talk to you about. The other thing that I just want to say really quickly before I'm done is there's kind of this big stigma out there that, when we as women, we need to be all of these things. We need, like, after we have a baby, we need to just bounce back within 6 weeks, and, you know, we have to have a flat stomach and blah, blah, blah. When we have a functioning core, it doesn't necessarily mean that we have to have a six-pack to do it. And oftentimes, just because you have a six-pack doesn't mean that the core is well functioning. And the reasons we want a well-functioning core is what I described earlier. We want to be able to have the best breath pattern that we can. We want to be efficient through all of our movement. We want to have that internal base of support. So having a pelvic floor and a diaphragm and the deep abdominal muscles working together is of utmost importance. And if you're pregnant or going to be pregnant or just had a baby, your pelvic floor plays a huge role in that. Obviously, right? But we can do things if you're pregnant or if you're trying to get pregnant. We can do things to prepare your pelvic floor for what's about to come. We unfortunately don't live in a society that is natural, right? We sit a lot. We don't have that natural up and down movement that our ancestors did. So our pelvic floor often isn't ready to give birth. We've got to just kind of teach it how it can open to allow for the passage of baby. So that's kind of where I'm going to stop. I could really probably talk about that all day. But if you have any symptoms and you want to chat more about it, of course, please reach out to me. My information can all be found at yourstrengthwithin.com. All of my contact information is there. You can email me, call me, text me, however you prefer to communicate is good with me. Just know that as you go through life, you never have to live with any of these symptoms. They might be common, but they're not normal. And there are plenty of pelvic health PTs out there that can help you and give you back some of the freedom in your life that you totally deserve and don't have to struggle with anymore. Thanks, guys. Bye.